Hi, my name is Amy and I came to New York Fertility Services on January 7th, 2008. I first walked into Dr. Batsafin's office in January of 2008. I had been working with an endocrinologist for a few months who had diagnosed me with PCOS. And once we had exhausted what he was able to do for me, he suggested that I see a specialist because I would most likely need to use IVF. So at that point, Google became my best friend. I researched specialist websites, I read reviews online, I mapped the distances of these places to my work office, and ultimately asked my mom. She actually told me that the doctor who delivered me was South African and that I should go with the South African doctor. And sometimes moms know best. My first meeting with Dr. Batsafin, he told me that if I wasn't pregnant in 2 years, then we had a problem. And I nearly fell off my chair. I wasn't expecting to hear that. I thought we had already done the waiting and that now it was time to make things happen. We started with a traditional round of IVF, and as is common with patients with PCOS, I hyperstimulated from the medications I was given to produce eggs. So we got as far as retrieving the eggs and fertilization, but had to cancel the embryo transfer. We were able to freeze 11 embryos though. So over the course of the next year, we tried 2 cycles of frozen embryo transfers, but didn't have any luck. It was about that time, in early 2009, that Dr. Batsafin started using IVM in his practice. So the difference is that with IVM, they were taking immature eggs, which means that I wouldn't need to take the doses of medication that I was taking with traditional IVF. We tried around with very little medication at first to try to protect me from hyperstimulating again, but that actually didn't work at all. So over time, he tweaked the dosages so that we were trying to get the maximum response from me without risking my hyperstimulating again. And on our 4th try, in early February of 2010, it worked, which was almost exactly 2 years to the day from when I first walked into his office and he told me it would take 2 years. Our son, Owen, is now 2.5 years old and is the most awesome and amazing thing to ever happen to us.